Greetings, greetings, greetings. Welcome to another session with Dr. Sesay. My name is Dr. Sesay. I'm a medical professional and also I'm a medical educator. Today we're going to talk about something very important. We're going to talk about what? Skills that can what? Save someone's life. Skills that you can learn. Yes, you can learn to save someone's life. We're going to talk about CPR. CPR. What does CPR stand for? CPR stands for what? Cardiopulmonary Resuscitation. Cardiopulmonary Resuscitation. But what does that mean? Cardio means what? Your heart. Pulmonary means what? Your lungs. So what's the whole point of doing CPR? When you are performing CPR on someone, we're suspecting to say their hearts have failed. Their lungs have failed. That's why the person need what? CPR. That's why the person require you, yes, you, to perform what? CPR on them. But the only way you can perform effective CPR on someone and save their life is by what? By you learning the skills. Today, I'm just going to talk about what? The basics of what? CPR. If you need more information, inquire. Right? The email is going to be right down here. Send me an email. Inquire about what? How you can what? Acquire the skills when it comes to what? Doing what? CPR. Okay. So let's start this lesson by talking about what? What's the function of the heart? And what's the function of what? Of the lungs? And why do you need to do the CPR on someone? The function of the heart have what? One purpose. The heart needs to what? Pump blood what? To the rest of the body. Yes, the heart, the function of the heart is to pump blood what? To the rest of your body. Meaning, the heart needs to pump what? Blood to your brain. The heart needs to pump blood to the lungs. The heart needs to pump blood what? To your muscles and the rest of the body. That's what the heart does. Well, what's the point of pumping out the blood? You have to remember, the blood have what? Oxygen and nutrients. And every single cells in your body require what? Oxygen and nutrients to perform what? A biological what? Function, so that way it can keep you alive, it can keep me alive. Without that oxygen and nutrients, those cells, those organs, those tissue will not be able to perform their job, so that way to keep me and you alive. So the whole point of what? Of the heart is to what? To do that. But for the heart to be able to do its job, it requires what? Three things. These three things needs to work together, right? The first one is vessels, blood vessels. Example, you need veins. You need the veins to what? Bring the blood to what? To your heart. You need the veins to bring the blood to your heart. When the blood gets to your heart, we need to pump that blood to what? To your lungs. That's where the pulmonary part comes in. We need to pump that blood from the right side of your heart into the lungs. That blood going to go and get what? Oxygen from the lungs, and that blood going to be pumped back into what? Into the left side of your heart. And from the left side of your heart, we're going to pump that blood what? So the rest of your body. So that way they can receive what? Their oxygen and nutrients. So that's how the vessels contribute to what? To the function of the heart. But one thing most people don't also realize is this. Your heart does have muscles. Those muscles help what? To pump the blood out. That's true. Your heart have muscles. But for those muscles to be able to contract and pump that blood out, they need a stimulation from what we call what? The electrical activities of the heart. Remember that. Your heart does have electricity. Most people don't know this. But that's true. Your heart does have what? Electricity. So all of the blood that comes into your heart, for that blood to be what? Pumped out to the rest of the body, we need the muscles of the heart to what? To contract. But before the muscles of the heart to contract, the only way the muscles of the heart can contract, we need that stimulation of what? The electrical what? Activities of the heart. That's the reason why they do EKG. That's the reason why we do EKG, to check, to make sure the electrical activities of the heart is working perfectly fine. But today, we're not talking about EKG. Our main focus is what? CPR. So let's do a quick review. For the heart to be able to function as a pump, it needs three things to be able to work together. What are those three things? It needs vessels. As I already explained, you need the veins to what? To bring the blood to the right side of the heart, and that blood goes to the lungs. Get what? It gets as much oxygen as it can. That blood going to what? Be pumped back into the heart on the left side. From the left side of the heart, now the blood going to be what? Pumped out to supply what? Your brain and the rest of your body. But for that blood in the heart to be able to be pumped out, we need muscles of the heart, and we need the electrical activities of the heart to stimulate those muscles, so the muscles of the heart will be able to pump out the blood. So now we have a little understanding of how the heart participates when it comes to what? Distributing what? Blood to the rest of our body, which means that supplying what? Oxygen and what? Nutrients to the rest of the body. The lungs. The lungs is very important. Right now, for example, let's take a deep breath. We take a whole bunch of what? We breathe in a whole bunch of what? Oxygen into our lungs. That's where the pulmonary part comes in. We breathe in oxygen. Now the heart going to what? Pump blood into the lungs, grab that oxygen, send that oxygenated blood back into the left side of your heart. From the left side of your heart, we're going to pump that blood what? To the rest of your body. So when we say you have to perform what? CPR on someone, it really means to say, we suspecting to say the person what? Heart might have failed. Simply mean the heart is not able to perform what? Its what? Function, which is what? To pump blood to what? To the brain and the rest of the body. It means to say the person's lungs might have failed, because the only way we can supply what? Oxygenated blood to the rest of the body, we need to breathe in the oxygen first. And our lungs is what help us to do so. Right? So that's the reason why you're performing CPR. It means to say we're suspecting to say the person's heart has failed as a pump, or maybe their lungs has failed in terms of what? Bringing in oxygen. But what's the most common reason why most adults will need CPR? What's the most common reason? The most common reason is because the electrical activities of the heart have failed. Yes. Remember what I said earlier on. For the heart to perform what? Its function, it needs three things. For the heart to be able to pump out the blood, it needs three things to work effectively together. Not individually, but together. It means to say what? The blood vessels, the veins needs to bring that blood into the heart. And the muscles of the heart needs to pump that blood out. But for the muscles of the heart to pump that blood out, what do we need? We need the electrical activities of the heart to stimulate that muscles. So that's the most common reason. That's why the heart fails. Because if that electrical activities of the heart fails, it doesn't matter if the vessels, the vein bring the blood into what? Into your heart. It doesn't matter if you have a healthy what? Muscles, heart muscles. The muscles of your heart will not be able to pump out that blood if the electrical activities fail, or if the electrical activities does not stimulate those heart muscles. And the most common reason, this is important, I want you to really pay attention to this. The most common reason why someone will need CPR is because we suspected to say the electrical activities of the heart have failed. The electrical activities of the heart does not what? Stimulate the muscles of the heart, and the muscles of the heart cannot what? Pump that blood to supply what? Our body, right? Okay, so why does the person what? Pass out? Why in CPR the person pass out? Okay, so we're going to what? This is Joe. This is Joe right here. Joe is one of our favorite co-workers, right? So Joe is very excited to what? For lunch, because we have the lasagna today. That's what we having, right? I don't know what you having, but right here today at the office, we having what? Lasagna. So Joe is very excited. We get to the lunchroom, Joe collapsed. The question we have to ask ourselves, what would be the most common reason why Joe collapsed? Why do Joe go unconscious? What are the reasons? Well, the main focus here, what would be the most common reason? The most common reason Joe collapsed is because Joe brain is not receiving what? Sufficient amount of what? Blood. Which means Joe brain is not receiving what? Enough nutrients and oxygen to keep Joe conscious. So that's why Joe collapsed. But the next question we have to ask ourselves, why does Joe brain is not receiving what? Enough oxygen or enough nutrient? Why does Joe brain is not receiving enough blood? The answer is simple. It's because Joe's heart is not what? Pumping the blood to what? To Joe's brain. That's where our next question comes in. Why does Joe heart is not what? Pumping the blood to what? To Joe's brain. It means to say Joe's heart has failed. Right? It means to say Joe's heart has failed. But the question we have to ask ourselves, the next question will be what? What will be the most common reason Joe's heart failed? What's the common reason why Joe's heart is not what? Pumping the blood to what? To Joe's brain that leads to what? Joe going unconscious or passing out. We already know the answer to that question because remember what I said. The most common reason why most adults heart fails is because what? The electrical activities of their heart has failed, which means the electrical activities of their heart fail to stimulate the muscles of the heart, and the muscles of the heart fails to what? Because they didn't get stimulated by the electrical activities of the heart. What happened? They fail to what? Pump that blood out to supply what? Joe's brain. It's not only Joe's brain not receiving what? Oxygen and nutrient. Joe's kidneys also not receiving oxygen and nutrient. And the rest of what? Joe's body is not also receiving sufficient amount of what? Oxygen and nutrient. The only reason why we know to say, we can see and probably tell immediately to say Joe's brain is not receiving oxygen and nutrient is because Joe passed out. For me to be conscious, my brain need what? Constant supply of what? Oxygen and nutrient. But if my brain doesn't receive oxygen and nutrient, what do you think is going to happen to me? I'm going to pass out just like Joe. Okay, so now we know the basic. Another common reason why is the lungs, right? So if the lungs, there's a problem in the lungs, then what do you think happened? Even if Joe's heart is working perfectly fine, if the lungs doesn't bring in the oxygen, there is no way the heart will be able to go to the oxygen, to the lungs. There is no way the heart will be able to go to the lungs and grab that oxygen and supply it to the rest of the body. We need your lungs to what? To bring in that oxygen. But in adults, in most adults, the most common reason is not so much their lungs, it's mostly what? The electrical activities of the heart has failed. Okay, so now let's go to the reason why you perform what? CPR. Let's talk about the reasons, or the reason why you have to learn the skills necessary to perform CPR. Now you have what? Basic understanding of why Joe collapsed, or why Joe passed out. The basic 3 steps that you do when it comes to CPR is 3 things. 3 basic steps. The first one is what? You do compression. The second one, you give breath. The third one is what? You apply the AED. We have our AED right here. This is the AED. This is how it looks like. It has a pad. Right? This is the AED. I'm going to talk about the AED very soon. But what are the 3 skills that you have to perfect and learn so that way you can save someone's life when that person needs you the most? The first thing you want to do is what? The 3 things that you do, you have to do all of them together. You do what? Compression, you give breath, and apply the AED. But let's ask ourselves, why are you doing compression? Why are you giving breath? Why do you need to apply the AED? Remember, let's go back here. We're doing compression because we suspect to say the electrical activities of the heart has failed. So we manually what? Stimulating the muscles of the heart so that way they can pump the blood out. That's the reason why you give what? Compression. And you have to do it right. You have to learn the skills so that we'll be able to do the compression effectively and what? Accurately. But the whole point of what? Doing compression is because we suspect to say what? The electrical activities of what? Joe's heart have failed. Since there is no electrical activities, the muscles will not be able to contract. So we are manually trying to what? Stimulate what? The muscles of the heart so that way it can contract and pump that blood out. So that way Joe's what? Brain and the rest of his body can what? Receive the oxygen and nutrients it badly needs. We also give breath. The reason why you give breath, it comes down back to what? Remember, we're doing CPR. Because we're suspecting to say the problem could be what? The lungs. So that's why we give breath. You have to give breath, right? So that way you can what? Manually what? Supply what? Oxygen to what? To Joe's lungs. Because Joe is not able, or the problem might be he's not able what? To do it by himself. So we have to give what? Joe breath so that way we can help him. We can help him. Remember, he's our favorite co-worker. So what does AED have to do with what? CPR. You see, the AED is the most important out of the 3 things that you need to do. Out of the 3 things that you need to do, the AED is the most important. Remember, what are the 3 things that you have to do? Compression, you give breath, and you apply the AED. But the question is, Dr. Sesay, why is the AED the most important? The reason is simple. Remember, it goes back to our question that we asked earlier on. Remember, when an adult passes out, when they need CPR, we're suspecting to say their electrical activities has failed. And this guy, AED, or this machine here, the AED is an artificial what? Electricity of the heart. This is an artificial electricity of the heart. If we're suspecting to say someone what? Electrical activities of their heart has failed, do you think it's important to apply an artificial electricity that can do the same job as what? The natural electricity that we have in our heart? Yes, of course, yes. That's why it's important. Because this guy here, the AED, or this machine here, the AED, is an artificial electricity of the heart. So that's why we apply the moment the AED gets to the scene, the very first thing you want to do is what? Apply the AED. Turn the AED on and apply it, because the AED will do a better job when it comes to what? Stimulating what? The muscles of the heart, so that we can pump the blood out. Remember, if you want to learn more about CPR, I will highly encourage you to inquire. Inquire to see how you can what? Learn the skills necessary to save someone's life. Okay, so let's do a quick review of what we have learned. Remember, this is the basics. If you need more training, please inquire. Right? So let's do a quick review. CPR. CPR. Remember Joe. This is Joe. Our co-worker, our favorite co-worker, right? So CPR, what does CPR stand for? Cardiopulmonary Resuscitation. But what does that mean? Why do you need to perform what? CPR on someone. When you perform CPR on someone, we're suspecting to say what? Their heart have failed in terms of what? Pumping the blood out to supply what? Their brain and the rest of their what? Their body. We're suspecting to say their lungs have failed. That's why we need to what? Come and what? Rescue them. How do we do it? We do what? Compression. You have to do effective compression. What's the point of what? Doing compression. Remember, the most common reason why someone what? Heart failed is because the electrical activities of their heart has failed to stimulate what? The muscles of the heart. And the muscles of the heart is not able to contract to help to pump that blood out to supply what? Our brain and the rest of the body. So that's why Joe passed out. So when we do compression, we are manually what? Stimulating the heart muscles so that we can pump the blood out, so we can rescue what? Joe's. We give breath because we're suspecting to say what? Their lungs might have failed. Right? Their lungs might have failed, so we give what? Breath to help what? Pump in some what? Oxygen into Joe's lungs, so that way we can supply what? Oxygen to what? To Joe's body, especially their brain. The AED is an artificial electrical activities of the heart. So the moment the AED get there, it takes priority. The reason is simple. It will do a better job in terms of what? Stimulating what? Your heart muscles, so that we can pump that blood out to what? To Joe's brain and the rest of his body that the body needs so bad. Okay, so now we have done a quick review. If you need more information on how to what? To learn more about what? Or acquire the skills of what? CPR, inquire. Inquire right here. I will tell you and give you the information necessary, so that way you can what? Learn the necessary skills to what? Save someone's life. So I will encourage all of you, go out there, learn these skills to save someone's life. Encourage others to learn these skills so that way they can save your life. Thank you so much, and I will see you again. Thank you. Have a nice day for now.